Lawmakers say South Carolina is facing a growing doctor shortage, especially in rural areas. So there was a meeting at the State House today focusing on a plan to expand the roles of physician assistants and nurse practitioners, as Caroline Yaffa reports.
Medical professionals say South Carolina is struggling to provide adequate health care because of lack of doctors. Lawmakers discussed several bills to try to fix this problem. The Association of American Medical Colleges says the U.S. could face a shortfall of up to 86,000 doctors by 2036. For South Carolina, that means longer wait times and longer travel for patients, especially in rural areas.
If we don't have enough health care providers in the pipeline to get to the most rural areas, we've got to come up with something that's going to allow.
Under current South Carolina law, nurse practitioners and physician assistants can diagnose, treat, prescribe, and practice, but they must have physician supervision. So the question is that supervision necessary?
Because of transportation restraints and other limitations that they have, they're not going to make it to a doctor, okay? But they could make it to a nurse practitioner who in theory would recognize the very things you're talking about and send people to the ER.
Physicians are often much more limited on time, which directly affects patient outcomes. Nurse practitioners are able to successfully tackle with knowledge and expertise.
But many healthcare leaders say nurse practitioners and physician assistants always need that safety net. They say they do not have enough experience to practice independently.
If you get the wrong diagnosis, the wrong medicine, you take your child to a psychiatric nurse practitioner who says they're bipolar and puts them on antipsychotics or whatever the situation may be, where if they had waited and seen a physician and that hadn't happened, potentially it could be a very different outcome.
Secretary Robert F. Kennedy Jr. and the Department of Health and Human Services think nurse practitioners should be given authority to practice.
Is HHS wrong at the federal level to point to nurse practitioners, top of practice, full practice authority, which is what they score? Is he wrong to point that out as being part of a rural transformation? Yes or no?
Yes.
He's wrong. Okay.
Yes.
In Columbia, I'm Caroline Yaffa.